Been trying to work on the organizers today
Yeah.
Okay.
to go through those.
You know, I'm going to pull heavily from things like that and
Mhm.
the Kahoots.
Mhm.
Okay.
Yeah. Let me see.
So the biggest thing that we're going to be going through basically all the E-stem stuff. Is that the biggest part of it? Or the largest part?
So you've got some stuff on biofeedback. There'll be stuff on iontophoresis. Know your medicines, know their polarity, know the general principle behind it. I want to say there is 3 questions on biofeedback, and they should be 2 of the 3 are easy. The third one, it's on the organizer. There is definitely stuff related to the skin. So know your cells, what they do, know your layers, that kind of thing. Know a little bit about hair, your glands, know about oxygenation with your skin, about aging. Know there will be a couple of pictures on there with some should be pretty obvious skin conditions. And if you see those, what would you automatically think they are? And then what course of treatment would you go based on that?
Mm-hmm.
Know your medicines for your major classes of diseases, viruses, funguses, lice, that type thing.
Okay.
Laser is on there. So know what laser is, the true definition of laser, know this. I think we talked about stuff on wavelengths. We talked about tissue depth of penetration. What does laser do? Of course, you always have to, with any modality, are there any contraindications or precautions? Brush up on those.
Mm-hmm.
There is some questions on the chain of infection, which I think you guys probably know better than I do at this point in time because you've had it several times.
Right.
So I'm looking through, there's several questions on chain of infection. Skin cancer is also on here. Know your risk factors for that. Know your stages of progression of cancer in general. What's worse, what's not worse, what are warning signs. There'll be some questions on here where I will give I guess a general basic outline of what I'm trying to do with a modality, and you have to choose which modality would probably be the best choice.
As far as like a patient case scenario?
It may have a patient case in it, or it may just say something to the effect of, there's a very small treatment area. It's a tendonitis. It's chronic. Patient doesn't like shots. What would be your option? There you go. So they should be, in my mind, I get that, pretty straightforward, but you will have to choose between your big modalities. So Ionto, ultrasound E-stem combo, like when would you use that versus Ionto? When would you use ultrasound E-stem combo versus TENS? Biofeedback, laser. So we're just looking at the overall general premise of when you would choose one modality versus the other if the PT's plan of a treatment said modalities of choice.
Mm-hmm.
And you guys should be pretty savvy, I think, on that too.
Sure.
Where are your Kahoots posted? I'm trying to find them right now.
Are
I
they
know
on
you,
the
oh, never
announcement?
mind. They're on the announcements. Never
Yeah.
They
mind.
are on the announcements. They may be in a couple different announcements because I think I put some of them together
Mhm.
after we had done them in class. Like I posted those, and so I post them after the class period. So they should be up there.
Yeah, I think they're in the announcements.
Yeah, they should be up there.
I
Of
see
course.
them now.
You see them? Okay, great. Of course, with, we talked about your drugs and what they're used for with Ionto, polarity. I think I said all that. And then there will be some questions differentiating with a patient which parameters you might have to use with ultrasound E-stim combo. So you've got some things to think about. Is it superficial? Is it deep? That's the big one. Are we acute? Are we chronic? To help guide some thinking there. So I did put a couple patient scenarios on there. With your electromodalities, there'll be, I don't want to say a review because it all sort of feeds in together with TENS, but like what type settings do you use with something acute? What pain control theory does that work off of? What would you use with chronic? What pain control theory does that work off of? That type thing. And then just basic, of course, contraindications. I think I said all that. And with TENS, basic things that you as a therapist would be responsible for either teaching or monitoring with any of those, helping set up, I guess.
Okay.
It's 50 questions. It's essentially multiple choice, but I do have some matching on here, which I've not done before. And I'm trying to think if there's anything other curveballs. I'm looking through the test right now. Now, and just the pictures, I think I mentioned that as well, that there would be some pictures of some skin conditions that you should be pretty savvy with.
Sure.
To identify, okay, what is this? And then what would I need to do based on that?
Will any of the recent stuff like the sterile field, wound
Nope.
care, anything like
Nope.
that? Okay.
Nope. No, we are just TENS, biofeedback, laser, Ionto. So we have those four modalities. And then we have skin integrity, or skin, the integumentary system, cancer, and we did it right before the chain of infection. It's on your syllabus, exactly what's on there. There's nothing, no surprises there.
Okay. It sounds manageable.
It should be. It should be manageable. So if you know your Kahoots and you know the information off your organizers, you should do really, really well. 50 questions.
Are we doing we're doing stuff after the test, right? It's not just the test. Okay.
Yes. We don't have time in our schedule to just, it would be nice. I know it's very hard to take an exam and not get to blow out of the class, but
Yeah.
I agree. I think that's a form of cruel and unusual punishment, but it is what it is.
Are we just knocking it out first thing as soon as
Absolutely. I'm not gonna ice y'all.
Yeah.
I like to get that stuff over with. So, I mean, clearly hey, is there any last minute questions? Anything I need to clear up? And then we'll launch into the exam. And then we have another lecture, woohoo, on wounds. I'll have a couple, maybe 3 wounds for y'all to measure. And then if we have time, I'll have a Kahoot ready on, trying to think what we've not done a Kahoot on. I think we've done the Kahoot on cancer. I don't remember. I'll have to go back and look which ones I posted. But I have a Kahoot on the wounds too, just because around the corner is another quiz.
Yep.
I mean, we're really on that downhill slide towards the end of the semester. So you guys still have 2 more quizzes after this exam and 1 more exam.
Okay.
Okay.
Kristen, did you have any specific
Yeah.
questions for Miss Roseberry?
I don't think so. I think all of it is pretty much, I don't know. I mean, some of it is review and like the chain of infection. And I feel like the other, we've already done the, you know, the practicals on. So I don't really, I can't think of anything. I was trying to look, see if I had written anything down, but I mean, I think the organizers do a really good job of kind of laying it out there. So
Okay.
not really.
Shout out.
That's
at-
good. That's good. I want y'all prepared when you come in for an exam.
Yeah.
If you're not prepared, I don't want it to be my fault. How's that?
Right.
I want you to have very clear direction on where you need to be studying and kind of what's fair game.
I know the
I will add
organizers-
this. I'm sorry. Go ahead, Bryce.
Go ahead.
When it comes to biofeedback,
Mm-hmm.
I feel like that's pretty, I don't want to say self-explanatory, but I mean, is it literally just as long as we are familiar with the organizer,
Yes.
that's pretty much, okay.
Yes.
Okay.
Yes. There are.
I just didn't want to make it
3
harder
questions.
than it is.
No, there are 3 questions on the test on biofeedback that are straight from the organizer.
Okay.
Know what its purpose is, maybe 4 questions. Know what its purpose is. There's a couple different ways you can use it, whether you're wanting to inhibit a muscle or try to facilitate a muscle. So understand that. There might be a question on there about the relationship between gain and, what's the other? They're in gain and
Are you talking about the
sensitivity.
sensitivity?
Yes, and
Okay.
so know that relationship. But outside of that, it should be very straightforward.
So like the portion
What-
where it says sensitivity and gain are inversely related?
Yes. Mm-hmm.
Okay.
And so, are there any contraindications for biofeedback?
No, as
just-
long as contraction isn't
Exactly.
There's a protocol. Yeah,
contraindication.
there's an
Okay.
protocol against
Very
it.
good. Yes.
I think the only one that I'm kind of not as familiar with is laser, because I feel like we haven't, I don't know, that's the only one I kind of
So,
haven't wrapped my head around completely.
I'm going to require a CSC for that one next semester, just because I do feel like not having a CSC has put y'all at a disadvantage.
Uh-huh.
I know they're a pain, but I don't really know any other way around it except to make you play with it.
I agree.
Yeah.
Because I feel like it was harder for me to digest the information because I just didn't know what it was like to put it on someone.
So with the laser, I mean, we have talked about it in class. What's the big thing that laser is used for?
Healing,
Healing at what level?
the threshold. No, that's
Like, remember we said it was kind of like a construction crew after a big storm. it brought a lot of cleanup at the cellular level and brought somebody in to do a lot of repair. So it's a lot of repair and a lot of cleanup of traumatized tissue. Is it something, if you use laser, is it something your patient's going to feel?
No.
Mhm.
No, it is not. So it is subsensory or subthreshold. There are some wavelengths that laser includes, and some of those are in the visible spectrum, and some of those are in the infrared spectrum. I would know that. I would know what a true laser is. Like at the beginning of the lecture, there's a bunch of stuff, a bunch of $3 words that give what part of the spectrum it is. Is it monochromatic? Is it polychromatic? Is it coherent? Is it non-coherent? Is it collimated? Is it non-collimated? So go back and refresh yourself with those terms and how that applies to laser. The tissue depth, how deep does laser go? How deep does ultrasound go? Biofeedback doesn't really have a tissue depth. How deep does Ionto go as far as tissue penetration? Go over those precautions and contraindications with all your modalities. And let's see. I think if you have those things, you will be in a really good place.
Cool. Well, I believe we can do that.
Yeah, I believe you can. Any other questions?
I think I'm good
Yeah.
for now.
Good.
You guys can always text or email me, whatever. You don't have to be formal. Just like I'm working, so if I'm getting texts and emails, I'm doing it while I'm working. So I'm short, sweet, and to the point, and I'm okay with that.
Mhm.
All righty.
Can I ask you, this is a really random question, and this is not pertaining to this test per se, but do you think modalities is going to be something that is used a lot in our first clinicals?
I think it depends on where your first clinical goes.
Okay.
Like you have to do an outpatient. And so some outpatient clinics are heavy modalities. I'm not a big fan of heavy modalities. I mean, they have their purpose, but I call them fake and bake clinics because that's all they do is modalities. But then you've got other clinics, outpatient clinics, that may not use one modality the entire time you're there. I mean, so I think it just depends on the clinic, on the spectrum. The clinics where I work have always worked, have always just sort of been middle of the road. They have their place and we use them, but it's an adjunct to the flexibility, the everything else that we're doing in addition to. So if you're doing outpatient, yes. If you're doing an inpatient, I can't really imagine a situation where you're really doing a whole lot of modalities, anything inpatient.
Okay, I say that because, you know, this is kind of one of those things like you don't really want to like learn and forget per se, but like I'm just going to keep all the PowerPoints. I'll just say that. I feel like because, you know, once, you know, it's kind of one of those things, I guess we just need to know this in order to like, will a lot of it be on our boards?
Modalities will definitely be on your boards. I mean, we wouldn't be teaching this stuff if it wasn't
Right.
we're accountable for and is not fair game material on your boards.
Okay.
Well, that's
So
the objectives, right? All of our objectives are supposed to be the things that we have to know for the boards. Is that correct?
right.
Yeah.
And that's why I think so I'm just gonna go out on a limb. I don't think there'll be stuff on laser on your boards because I think that was why we didn't require a CSC for it, was because it wasn't required for y'all to graduate. But because it's out there pretty frequently, we needed to teach it. you know, I didn't want you to get in the clinic. Like I came out of PT school, I'd never seen a laser because we didn't have that stuff in PT school. And so I'm in the clinic doing some outpatient fill in, and that clinic has a laser. And I didn't know how to use it. That's just me being truthful. So you know what I went and did? I went and asked the PTA who worked there, hey, show me how to use this laser.
Mm-hmm.
And during lunch, I did a quick tutorial, and that was my intro to laser. Is that ideal? No, I learned some stuff when I taught this lecture because it gave me access to some information that I'm not going to go out and buy textbooks and things like that, you know. So I had some access to some information that I just wasn't going to normally have access to. So that was helpful. So our goal is to give you a solid foundation. So for the most part, yes, it's fair game on a board. Laser might be your one and only exception because, like I said, we would be requiring a CSC if it was, is my understanding. But I do think I'm going to require it next year just because I think it will increase patient y'all's comfort level with it.
Yeah, I agree.
Yeah. Other questions? Good question.
That's it.
Okay,
I'm good.
you're good?
I'm good.
All right, very good. Happy studying.